Hey, good afternoon. This is Lebanon in Depth, and this is our first of 2 holiday shows. This is kind of the spirit of what we all should be, is to pull together and to help one another. And we have today with me, we have a really wonderful organization. It's Good Beginnings of Sullivan County. And I, of course, went out, my standard, it's because I take all the benefits. I buy eggnog and I buy Christmas cookies for these shows. So I'm off my diet, only for the show though, only for the show, and then I'll be back on it. So if Dr. Socher is out there watching me, it's just, I'm just doing this for the show. It's part of showbiz. So with that, I'd like to introduce Ali Titsi, and I'd like to have you talk about Good Beginnings of Sullivan County and a little bit about your role, and then how we're going to back about with this organization that I just greatly admire and serving and helping others.
Thank you, Greg. Thanks for having us on today. And happy holidays to you and to all of the wonderful people who work for the City of Lebanon and live in the City of Lebanon. Good Beginnings of Sullivan County covers not only Sullivan County, but Grafton County as well, Lower Grafton County, the City of Lebanon. So 2 counties actually it covers to some extent.
Right,
and we originally were only in Sullivan County, and then we expanded our services into Lower Grafton County probably 3 or 4 years ago now. And we provide professional home visits to families who are struggling as parents generally. They are either pregnant and have some complications or are at risk for complications, or have a child, a baby or a young child, and they need additional help. We provide nurses, certified parent educators, and a licensed mental health worker who go into the home and help children and families to get off to the best possible start in life. So this is a great program for us to be on, because at Christmas time, the focus often is on children.
Yes.
And we are very happy to have the focus on children at this point. The needs of families at this time are significant. We're seeing a lot of families where parents have lost their jobs, families that have special health needs, children with special health needs, and there is a lot of need out there. And so our role is to go into the home and help parents in their own environment and help the children get off to a really good start in life. We know, all of the research has told us now, what we've always known intuitively, but now there's a science base to tell us that those first years really count. They make a difference not only in the first 5 years, but they make a difference for the rest of one's life. We have scientific proof now that what happens in those first years actually influences things like heart disease in adults.
Wow, that's incredible.
Yeah. So now we know this for sure. And so it's very, very important for the health of the whole community to give kids a good start in life and a healthy start in life. Prevent trauma, prevent poor birth outcomes, and to promote the best possible health, socially, physically, emotionally, nutrition, the whole range of health.
Just the whole 360-degree approach to when Good Beginnings of Sullivan County enters into a situation with a person that you're serving. It's like, sounds to me like it's like real wraparound, looking at the situation, assessing it.
Exactly. We do kind of a variety of things, but we provide care coordination and case management. We assess needs. We do a lot of screenings, developmental screenings of children, depression screenings of mothers. We look at the home environment. Is it safe for the family? And we do a lot of work with collaborating agencies to make sure that families have the services that they need. We don't necessarily provide all those services. We work with the partners in the community to help get families connected depending on the needs that they have.
So it's a collaborative effort as well.
Definitely.
So that when you do the needs assessment and you determine there are possibilities here of some need that could be also contributed toward meeting by another entity, then Good Beginnings Sullivan are one of those collaborative partners we have.
Right. You know, recently we saw a mom who had her first baby when she was in 6th grade and went on to have 3 more babies. Is now in her early 20s with 4 young children. When we started working with her, she was homeless. She had a significant medical issue. One of her children had a significant medical issue. All of the children were hungry. There were enormous needs, and she walked in off the street.
Wow.
You know, and now she has a home. Her children are in school or childcare, and she is starting to look at, you know, some educational opportunities for herself, and starting to move toward independence.
That is that's a wonderful story. You know, that's a real holiday story. It's a story year round though, because even though here in the holiday times we often start feeling, you know, our emotions and, you know, our spirit is you know, in a certain frame. I know I get that way. I tend to get, you know, I get teary-eyed. I tend to get that way. But I think the important thing for all of us is that when we pull together to provide the help, in terms of support, the hand, whatever people need, is that we should do it 365, 24/7.
Right.
And we should never stop until we reach a point where we're a better place. Because there's no reason that people need to be alone in facing challenging situations. Things happen in life. And it would never happen to me, but it can very much happen in your family. You don't know when that might happen. And you could, whether it's your neighbor or it's your family or it's the persons that go to the school with your children, that this is really all of us. So this is not a case of the other. There's no one. There's no other here. It's us. This is us.
Exactly. And, you know, I have to say that that's one of the best parts of the region that we live in. I'm probably a little biased about this.
Yes,
but
I know you really have great pride in this area you live.
There's a very caring community that really wants what's best for children and families here. And people step up. People volunteer. People donate to our thrift store. People donate funds. People donate diapers. People donate toys and books. And we have First Baptist Church of New London has started a whole book project with us so that we can give a new board book to every baby in our program for the first 3 years of life. So, I mean, that's a significant investment in family literacy. And these are babies that wouldn't have board books otherwise. So there are many initiatives like that come from people in the community. They really care about the future of their community. They know that we're an aging population, and in Grafton County, it's, you know, they call it the silver tsunami, and we are really aging in New Hampshire as a whole, but in Grafton and Sullivan County, young people are moving away, and the young people who are here, we need to invest in them now, because 20 years from now, there's going to be even fewer young people to carry on the work and do what needs to be done in the community. We need to look at those young people now and give them the tools, give them that great start in life that's going to get them through school and through life, and give them a healthy life That's how we improve the life of the community.
That's really an incredible example of sustainability and resiliency.
Right.
Because, I mean, one of the core outcomes that the city has identified through the leadership of the City Council has been the sufficiency and resiliency in our community for everyone. Right. Everyone should have sufficiency and resiliency in dealing with our world. And the generational thing, as you say, that's very insightful, because it truly is the pattern of the demographics. I mean, I'm part of the wave being born in '46 that are sweeping through, and we are getting older. And unfortunately, my eyesight's in a wave. You know, it's like the night driving starts to be a little bit. You know, there's all kinds of things going on with a person, and the younger generation, if they get fewer in number and they have to carry on in a more difficult world, where you have to have the competencies, the competencies to be able to communicate well, to kind of plan and self-direct, and to look at this new wave of technologies you end up living with now, and create places that people will want to live and be, and so many other places get abandoned and left behind, and we don't want to be that way. We want to be a healthy. We want to be a healthy community.
And we want to be a place where people want to raise their children. And we are that kind of place now, and we want to just keep beefing that up.
But I notice I know that you have, in the good beginnings of Sullivan County, that there's a bit of a beating you've been taking in terms of just the funding environment, the things that are out there, I'm not sure we got our priorities straight in our world yet. It seems to me it just keeps sometimes it's devolution, and not the kind of evolution into a place we want to be with funding. How hard you been hit?
Yeah, it's been pretty bad. The state of New Hampshire has basically eliminated all funding for prevention of child abuse and neglect, but of course there's still millions of dollars for treatment of child abuse and neglect, because that's mandated.
Yeah, so that's required, but that which is not required is that's
right, and that has been completely just decimated. And so that's one of the things that we're hoping will change in the future, is that there will be a greater focus on prevention, because it's very hidden, but there is a lot of child abuse and neglect that we see, and that doesn't bode well for us and for children. And we are trying desperately to support families, and when we also provide a service when children are removed from the home, we provide the services to reunite the family. And we don't want that to be as big a part of our service array as it is right now.
Yeah.
It used to be a much smaller part of what we did, and that has been a larger part of what we do recently. And we would like to see a lot more focus on prevention than there currently
I really
is.
do share that. Now, as we close, if people want to help Good Beginnings of Sullivan County, how would they approach it?
Okay.
What would they do?
Well, they can volunteer, so giving your time. And there's lots of ways to volunteer, from our thrift store to administrative help to working directly with families after training. Giving your talents. So if you have a particular skill that you might offer. And then treasure. We have a children's thrift store that operates out of Claremont that helps support our program. So saving your children's gently used clothing and items and baby supplies and donating them is very helpful to us. And then certainly making donations. This time of year is really the time of year that we solicit donations to our annual appeal, and they can go on the website, gbnh.org, and give a donation. That's very helpful to us.
That's great. And what we'll do is we'll put the website up on the show today, so that people will see the website and they'll go right to the website.
Yeah.
And follow the website's quite well put together. I've went into it. It's really great, and go into it. Well, I guess the message here for Good Beginnings of Sullivan County is they're doing wonderful work for our community, and I want us all to think about strongly how we can better support them in that effort, and let's all do our part. My first role in life as a theater person was as Scrooge in my 6th grade class, and I was Scrooge. And I don't think we should be a humbug Scrooge. I think we need to be the Scrooge that saw the light, what the future would lie, and that the future can change because we can change. And so we should change and do better, and pull together and do better by Good Beginnings of Sullivan County and the other providers we have who are trying to serve people. They're with us. Let's help them. Thank you, Ellie, and give my thanks to all the members of your Good Beginnings of Sullivan County. And you're going to have to take a cookie and take your eggnog with you, and have a delightful holiday season.
Happy holidays, Greg.
Yep, happy
Thanks
holidays.
so much.
Thank you so much. Hi again, this is Greg Lewis, and my guest here today on Lebanon in Depth is just a wonderful organization, and it really provides our great home care nursing and great hospice care. And I have with us our development director, and Catherine, could you just introduce yourself and then describe the name of the organization so it could be properly characterized?
Sure, Greg. My name is Catherine Hogan. I'm Director of Development and Community Relations, and we have quite a handle for our organization. It's the Visiting Nurse and Hospice of Vermont and New Hampshire. You can say VNA of Vermont and New Hampshire if you want to shorten that a little bit.
Okay.
And as you said, we are a very big part of the healthcare safety net in the Lebanon area for people at risk, and not only for seniors, but people of all ages, but a great deal of the people we serve are 65 and older. As you said, we provide home care, home health care, hospice, pediatric care for people who are dealing with children with chronic illness, and wellness and community programs for seniors in the community.
Well, that's very diverse, and I think I think of you all as, you are the ones that you take our health care right to us, right to the grassroots. And these very just incredible, impactful situations people face in life. Whether, whatever it is, post-hospitalization, where we go into deciding how we're going to, in terms of our last days. These are just, they're critical situations, people trying to get themselves back into condition to try to recover from whatever they've gone through. There's so many things on it. And in your role, what do you see as some of the essential services that your organization provides?
Well, as you said, it's a very intimate relationship that we end up having with the people that we serve. Our field staff, our nurses and social workers and licensed practicing nurses and home health aides, there's a whole team that really wraps around people. But what they end up becoming really is a very intimate part of many, many households throughout the area. We made in the last year, just in the city of Lebanon alone, more than 10,000 home visits to people, which means essentially it boils down to every single day there's at least 27 times a day where there's a nurse or a physical therapist who's visiting someone in the community. And often what we find is that for some of these folks, it might be a frail, isolated elder whose family is either gone or lives somewhere else. And sometimes that visit from one of our nurses or one of our field staff is the only contact they have with anyone. So it's much more sometimes than just the health care, the important health care that they need. It's that intimate contact. And this has been going on for generations. We've been around for over 100 years. And most of the time when I talk with someone on the street, they can point to a time when their great-grandmother or their grandfather or their mother. That's right, because over the course of our lives, we go through times when we need help. And what's happening in our changing healthcare system now is that what used to be just a nice, important home-based visit from a nurse is actually becoming a much more critical part of the full healthcare system of delivery. We're not staying in the hospital for days and days after our surgery. We're
You're
going
pretty well
home.
out of there fairly fast.
So you want to be able to be sure that the care you're getting once you get home is as excellent as the care you were getting when you were in a hospital bed.
Yes.
So that makes the importance of what we're doing all the greater, and it raises the cost, it raises the level of skill that we have to have in these teams, and it makes us, again, a much more crucial part of the health of the people that we serve.
Well, that's wonderful. You know, and such dedicated people. I know I happened to visit I have this really a schedule where I try to have a listing time for the different service providers in our community, and I was over at your place.
Great.
And that was last year. You were so busy. We kept missing one another this year. So I'm going to make sure that you're the first one to be visited. I usually start the visitation in May, and I was impressed by how bustling it was. It was over there on Bennington.
Benning Street.
Benning Street. And it was bustling. It was just wow. You know, and just things are happening, and
you can imagine.
I can sense the energy there.
Definitely. We have about 150 different field staff, and we're serving not just Lebanon, although Lebanon is definitely one of the largest concentrations where we work, but we cover a 4,000 square mile area.
Wow, that's a lot. That's really a distance.
It is, and our nurses altogether put about 1.5 million miles on a year.
Wow.
And they're going into, rural areas where, like I said, some of these folks are really isolated.
Yeah, the isolation piece. So tough on a person.
Absolutely. I mean, with the plans with the city, one of the biggest issues, whether you're talking about access to health care or education or other social services, is transportation.
Oh, yeah.
So having services that are coming to you and coming to the community is so essential.
It's such a circuit riding thing. And and to bring health care to people. And help relieve the isolation to people and the contact to people. And
make them feel connected to a community. I mean, our nurse will go in and at that point in time, the patient maybe isn't, the IV, drip isn't the critical thing, but talking to the wife or the other caregiver in the household who's saying, you know what, we need food stamps. We don't need an IV drip. And so our social workers are there, our field staff are there, and we're really a network for them.
So when you do the assessment in developing the plans where you work together with the patient and their family in developing a plan for the care and what the services are needed, there's a lot of look-see at the different aspects of whatever the experiencing is going on there in that house or that home or that apartment or wherever that may be.
Because we know that's all those things are factors that affect health risks.
Yeah, it all comes back, and I know it's really fast. Today is so different, in the health risk calculations where before, I kind of grew up in kind of actually there was house calls. My doctor was Dr. Barnes. I remember how Dr. Barnes was coming, and he had a little black bag. It was really it was right out of the, the 50s is when I grew up, and that's how, now, it's just a world of difference. And if we didn't have your organization and the nurses and the social workers and the therapists and the social work, that would just be such a big gap.
Huge.
Just such a big. I can't imagine our world without people that are serving in your organization. And
they're so dedicated. I can't tell you that they astound me every day.
Yeah, when I see somebody that's working in public health nursing, my wife. I told you she was a nurse in intensive care, but she kind of grew up under the mentorship of a nurse, and she was a directing public health nurse, kind of really the epitome of public health nursing. And to think about the dedication of people that engage in nursing in the public and out there in the field and in that car and the conditions I get frightened anymore about in the mountains driving around, and they're out there and
they've got the shovel and the sandbag in the back, and if they get stuck they get out and walk up the road and get to the house.
Very pragmatic, practical, skilled nursing people.
They might be the only one that gets through there,
to get in there after them. Now, how have you been faring? I've been, as this spring season's upon us, I am so committed to everyone pulling together, and I feel that we're not going the right ways in the way we do things in some of our service providing in the healthcare field is an exemplar of a rapidly changing environment, and some of the changes aren't for the good. But how are you faring funding-wise and development picture for you?
Well, you know, like many healthcare organizations and community-based nonprofit healthcare organizations, we're getting some big challenges hitting us, and they're going to keep hitting us, as we know, over the next few years. We've been doing what the city's been doing in terms of some real strategic planning and trying to, you know, create greater efficiencies, greater innovation, so that because we're really being asked to do more with less every single year. Between the sequestration, the federal budget sequestration last year, which, as we know, has pretty much become a regular part of business.
Sequestration was just really very impactful. People don't realize how much losses we incurred because of that.
They think it's a DC thing, but it was a direct hit to us, and it continues to be. And a very large proportion of the services we provide, we're reimbursed for a great deal of that through Medicare and Medicaid, and then the support we receive from the community helps to cover costs of care that exceeds that cost. Plus, we serve everyone, regardless of ability to pay. So we really rely on community support to create those buffers, so we don't have to turn anyone away. But the adjustments that are happening now and in the years to come with the Centers for Medicare and Medicaid rate reimbursements mean that we are, it's as if we were a company building something and starting at a certain point. We're going to be producing it at a greater cost than we can ever bring back in. Kind of what you're faced with property taxes.
Yes,
how do you strategically think about making sure you stay strong and bring everyone together and leverage the resources you have without being completely dependent on one source? So
yes,
it's a
single
struggle.
source funding is it's just not the way we need to do business. It's not the way we need to care for each other, because there are diverse economic components around us.
They're shifting all the time.
They're shifting all this movement, and there's a lot of vibrancy in this region, unlike other regions where it's more kind of devastated
and ingrained.
We really have this vibrancy. And we need to figure out how we can tap into it and share that vibrancy among all of us, because, you know, as I've said in my visits with all the folks that serve our community, we have to contribute to the common cause. And we have to figure out how to do that sort of thing. And we really can't do the pile-on and the property tax single source.
No.
Because that just doesn't make any sense. That's not a sensible thing. To say you're going to spend you're going to get all the money out of the fact somebody owns a parcel of property. That wealth is not measured by parcels of property anymore.
No.
Wealth is measured by many things. You have all these different types of investments, these types of incomes, these types of how profits are generated, and how you use things, and certain uses should have some attachments in terms of income. It's that there's no free lunch for this situation, and we have to pay, and let's just reprioritize.
Exactly.
Let's just reprioritize. Take all the wealth, and let's all do it together. And as those who contribute also help in deciding how the dollars shall be spent.
And it's important. Altruism is a critical thing. It's the holiday season. We all want to care about one another.
It is.
But I think we all, at the end of the day, come to realize that if we're not creating these safety nets, if the boat is sinking at a certain level, we all go down. I think these services, and I know that you've made sure that in the outcomes with the town, there's a real focus on, as you say, sufficiency and resiliency. And I think making sure that whether it's healthcare or education or nutrition, that everybody gets access to resources and has the opportunity to thrive is important to all of us.
Absolutely. I think we all have a natural law-given right to have our physical needs met. We have the same feeling about our needs, to our emotional needs and needs to be loved. We need to learn together, because we stop learning, then we stop thriving. And you know, we need to all live for generations. Not just think of our present generation, but we have to live for the generations that are with us now, the new ones. I love them. They're young and they're wonderful. And we need to live for the generation that's going to follow. And to do all that stuff, we just kind of re-look at what we do, and let's really look at it from a blank page, and let's contribute. Now, if there was, maybe it would be good for you to restate the name of the organization. And if people want to support the organization, well, I very much encourage to pull together and support your organization. So what would be the full name, and how should they provide support? What's the way to do it?
Sure. It's the Visiting Nurse and Hospice of Vermont and New Hampshire. You can donate online at our website at VNAVNH.org. That's VNAVNH.org. One thing that we find is very rewarding at the holidays is to make a gift in memoriam or in honor of someone. Instead of getting another tie or another scarf, you can make a gift in their honor to the VNA, and that money helps people in need and helps people feel good about the holidays. Or you can mail a check to P.O. Box 976, White River Junction, Vermont, 05001.
That's marvelous. Well, I thank you, Catherine.
Thanks.
And as we end our show today, in the holiday season, I'm going to raise my cup of
we're having a party.
Delightful. This is local, beautiful eggnog, and we toast to the nurses, to the therapists, to the social workers of the VNA of Vermont and New Hampshire, and all those who care for others. And we toast those who are being cared for. Here's
Thank
to
you. Happy holidays.
Happy holidays.